So we found out in our, I did a previous session, a previous hour, and we found out that there was a camera here. Oh, it's been moved. This camera here on the wall.
Oh, I think it's tilted.
Does it follow you based on the voices?
Oh, no.
No, it was in last hour, it was pointing here. Somebody moved it. It doesn't matter. That's why, because it was pointing to the back of the room and it was showing up on here. So everybody was sitting in the back of the room because of that camera. And it's not the same today. Okay, anyway. So thank you for coming to this breakout session. And so you're going to be the contributors to, hopefully we'll make some decisions in this breakout. The hour is going to go by really fast. And we've got a lot to cover. We're going to cover a lot of the same things that we've been showing on our last couple of calls. The same slides and the project that we're doing and the different steps of those projects. And we wanted to, with this hour, kind of get down into, okay, how is each step going to be accomplished type of thing. But we have about 10 or so steps we're going to go through. We have, 50 minutes left. So we're not going to spend a lot of time on each step. But just so please do some quick suggestions, like this is what we should do, this is what we should do. Were you going to capture this? Okay, because you had your fingers ready to go. I just wanted to make sure. So Pratisha's going to capture. First of all, I guess we need to do introductions. So my name's Grant Wood. I am from the US. I co-lead the Family Health History Flagship project. We get to have the word flagship in our name. That means they're really important. All right, they're cute kids outside.
Yeah, no, doesn't get you. Sorry, we're not paying attention to you.
I mean, they're really cute kids, aren't they? My long term. Okay, good. The last cute kids. My long time co-lead is Theodora. Go ahead and introduce yourself.
Not that cute, I imagine, but yes. Listen, anyways, I'm Theodora. I'm now based in Athens, Greece. I'm working at the National Hellenic Research Foundation, which is like the national research infrastructure of the country. And with the grant, we have been dreaming all along, and now we are very enthusiastic that we are implementing together with you all family health history. We truly believe in the value of such information for risk assessment, for making decisions, for making better informed decisions. So yes, this is what we do. And recently we have welcomed Pratisha not only as one of our national champions in Nepal, but also as an early career investigator. I'm not good with all those terms.
Yeah.
Co-leads, co-chairs. Now we are co-leads. So please, Pratisha, thank you for all your impact and your efforts, and what you're doing is truly valuable.
Thank you, Theodora, for such a wonderful introduction, Lalvita. So I am Pratiksha Gyawali from Nepal, and I've been working with G2MC, especially FHH Flagship project with Grant and Theodora since very long as a member. And from last month, I've been assigned the role of co-lead, and I'm also working in the capacity of early career investigator in the G2MC. Yeah, and pleasure to take notes today for this session. Yeah.
This is the first time I've met Pratisha.
Me too.
Yes. We've been working together for 2 or 3 years.
2 years.
Yeah.
More than 2. By email.
By email.
Like a Zoom mail.
And Zoom. Let's go from the back to the front. Shane, you might go next.
Yeah, I'm Shane Quinones. I'm a medical geneticist at the University of Michigan, and I've also, I think, been working with the FHH group for a little bit of time, and I've fallen off recently because the meetings are when I have clinics, so I haven't been able to make the last couple ones. But yeah, excited to be a part of this group, and this group's been invaluable for a lot of the work that I've done. So really, really happy to be a part.
I am Chidi Jaja. I am a professor of nursing at the University of South Florida in Tampa, Florida. My training is my postdoc is in pharmacogenetics, but my clinical training is in psych and mental health nursing.
Okay,
I am involved in health system strengthening and capacity building in a tiny country in West Africa called Sierra Leone. I have 2 NIH-funded grants in the training nurses of the newborn screening, the point of care testing for sickle cell disease, and also how to do genetic counseling for family victims of homeopathy. Recently, I got funded by Novo Nordisk to train nurses how to prescribe disease-modifying therapy for sickle cell disease in Sierra Leone.
excellent, excellent. So you live and work in Tampa,
Travel
but
back and forth.
we go to Sierra Leone. Okay, great.
Hi, so I am Zena. I am coming from the UAE. I'm originally from Syria, but I'm working now in the UAE, which you know maybe as Dubai.
Yeah.
So I'm working in pharmacogenetics, and this is the implementation of pharmacogenomics in the country. My
Great.
project. I had the PhD from there and pharmacogenomics, and since then I'm working as postdoc in the same area.
Okay, great.
Okay. Hi, I'm Nirmala from Faculty of Medicine, University of Colombo, Sri Lanka. And I am a professor in medical genetics, so I'm involved in teaching undergraduates and postgraduate students, training on genomics. And also my area is cancer research. So I think the family history concept here, it will be very useful for me. And I'm also involved in training, as I said, so the training and contributions and developing tools like that. And so basically, and then recently I joined the GGMC as a co-lead in the workforce training committee. So presently that's what
Great, thank you.
Hi, my name is Tia Robinson. I'm from the US. I'm working with the National Human Genome Research Institute. And I'm not part of this working group, so I'm just kind of here to learn and observe.
You are now Taylor.
But I'll be presenting later in the conference about a family history resource that we use at that in the US and now expanding to Nigeria and Australia. So
So you said that NHGRI?
Yep.
Okay.
yes.
Yeah, great, great to have you. Dr. Kong, why don't you go next?
Okay, hi everyone. My name is MK Tong. I'm from Malaysia. I'm a clinical geneticist. I've been working on family health history for quite some time, but with not much success, I'm afraid. We've been trying to incorporate, family health history into electronic medical records at part 1, and then part 2, we try to make it into a genetic assessment tool, and then part 3 is to incorporate psychosocial aspect to the software, so they can be used anywhere in the world in the language which the localized language, so wherever they work. So that was just my idea on the family health history. Thank you.
He's been a long time member of our family history group, and when he says we still haven't achieved the work that we want to accomplish, makes me think of my own experience. I started 18 years ago with a clinical genomics group in where I live in the US. And I was told when I started 18 years ago that my responsibility, and I'm on the tech side, my responsibility was to get genetic test result data and family health history data in the patient health record. We still haven't accomplished that. So yeah, we're in the same place. Okay. Oh.
I do want to I'll introduce myself. I'm Mary Towery. I do communications for G2MC. But I also wanted to say if anybody does any social media posts during the conference, if you could use the hashtag G2MC Geneva. That way it'll connect with our social media accounts.
Okay, great.
And so I'll be floating around, maybe taking pictures, maybe speaking.
And that's right, go ahead.
I'm so
Introduce.
sorry. I'm Emma McGavin from London. I like coffee a lot, so apologies for the tardiness.
Yeah, my main sort of genomics work is actually pharmacogenomics. But I am also an internist and acute medic. So I'm really interested in the family health component because practically clinically in acute circumstances in hospitals, we tend to do a very bad job of getting family history information. And sometimes that's a problem. So I'm very curious to hear.
Now, do you know each other?
We came from that other room together.
We met each other and have been bonded and decided we're gonna hang out.
Okay, I'm gonna jump in. Like I said, we're gonna kind of go this kind of fast. And this is something we have been talking about on our calls, last several calls. But I've broken down a family health history implementation, kind of a generalized implementation. So this isn't specific to any one need using one tool in one country, you know, on one disease. It's a really general kind of steps that we want to go through. And we decided that breaking down these steps, and I've got 11 on here, and we did this online, and we had people go in to this slide. This is kind of a odd way to use PowerPoint, but I was using it as a form, and people could see the step, and then they could see what we kind of, here's a description of what we wanted to accomplish in this particular step. And then people would volunteer and say, yeah, I want to participate in that particular step. What do we want to do? And we're only going to take a few minutes for each step to be able to go through this, to say, okay, this is perform a needs survey among clinical colleagues. How, and these are people, and I actually have, I think, some names on the next slide too. Oh, wow, we even got more people. I want to put it in there too. So on this step, what do we think should be, as a group, what should we do to move this step forward? Now we've got 2 people here that signed up for it. So well, let's start with you. What will you do? What do you think you will do to move this step forward?
I think the first thing to do is to get everyone on the same page, because right now we have quite a bit of diverse thoughts and opinions. And then once we are on the same page, I think we should move forward and get some results soon, because we need to prove concept and the need is there. And once we have a paper out or a position statement of some sort, I think that would be the impetus to get the rest of that going.
So we had talked about Pratiksha had done a survey in her country, and we shared the draft of that with other people. Was that the right step to get others to do a survey?
I think so. Absolutely.
Okay.
Thank you.
Any thoughts, Pratiksha? You were also a volunteer here.
Yes, so we have done this need assessment survey on FHH that has questions regarding whether they take FHS in their clinics or not, the physicians, and what are their abilities to take FHS. So sort of a survey can be modified depending upon the country. And yes, I think that would be initial step. That would be great initial step moving forward to understand the need of HHS and its benefit in longer run in clinical outcome.
Great. So I think, and you jump up and say anything at any time. Okay.
Thank you.
I think for this step, then we probably should do.
Reignite this.
Yeah, but in future calls, instead of a call that goes through all the steps, we'll do a call that just will do step 1,
Yes.
or maybe step 1, step 2 at the most, or something like that.
Yeah.
We'll just focus on one step on that call. And we'll ask these people who have put their names down, and we're very happy that you did, to say, okay, I'm going to commit to doing this next step, and this is how am I going to do it, and that type of thing. And I will try to have results in a couple of months or something like that. And we'll maybe set a date to have a report back or something like that. I'm just throwing out ideas here. Just to finish that. So does everybody know what I'm talking about when I'm talking about a survey?
Yeah, well, yeah, I guess the question I have, because I've missed a bunch of these meetings, is I kind of don't know what step 2, 3, 4, 5, and 6 are going to be. So I'm a little like hesitant to suggest a comment on step 1 if I don't know kind of like where the things are going. Meaning like just like sort of like a global picture of what like
Well, the other steps are not going to talk about surveys.
unrelated to this. Okay.
This survey is only on step 1.
Okay, perfect. Okay.
So
Thanks for that, Grant. That's perfect. That's perfect clarification for me.
Like I say, does anybody have any questions about what we mean about doing surveys? Or
Is it of just G2MC? Oops, sorry, go.
No, please.
I was saying, is it just of G2MC colleagues, or is this colleagues outside of G2MC too?
side? So it's like your colleagues who probably have no idea what G2MC is. So
Actually, because I feel like I'm outsider, this is the first time I'm just exploring how can this FHS contribute to my field of interest, and how can, and to be honest, I'm still like looking at. So the first step is you're surveying to find how this is practiced already in different places, to start from the same page.
yes, yes, exactly. Yeah, because within this group, within this G2MC group, we have the champions of family history in their countries. So as the champions, we want to know, and they want to know, okay, amongst my colleagues, what are their interests in implementing family history as a clinical tool? What is their interest? What is their needs? Will they join me in an activity? So that's what the survey.
What are the challenges they're facing? So we can
Challenges, yes. Yeah.
figure out some solutions.
If I may, like 2 seconds here, Pratisa has put forward a survey, and she did so in Nepal, and she could map the needs, the challenges, but also the opportunities. So if in this discussion today, you will see a series of steps we as a group thought, and Grant strategize those so that we can see which steps are more mature, which are more close to the people and to their needs. But so, for example, if you think that your hospital or your city hospitals or at the national level, education is key, Pratisa surveys has some questions that relate to education. So you don't need to come with new ones, or if you need new ones, this applies to all of you, this survey can be modified. So then Grant and myself and Pratisa will put forward a timeline, not in a mode of checking you all, but in our best will to help you on that effort, so that we can have then a decision, a statement, a paper, like this is what happens at UAE, this is what happens to, in Nepal, in China, in Greece, in Spain, whoever comes along.
Great, thank you.
So is there a generic survey that is ready to be deployed in different settings?
Yes, I think so. If that's what's most important to what you want to accomplish, then I think yes. Okay.
But in that case, I would like to do a survey and see what we do.
Yes. Great. Okay.
So I guess one thing I would add is I think it'd be really useful for you guys to think about the items on, let's just say, Pratiksh's survey that you really want to know, and that are asked, the exact same question is asked of all of these locations, rather than 10 different surveys with each their own different version of the question. So that I think sort of in the strength is number sort of vein, like if you have 5 items that are the exact same between all of the regions, I think it does make the fact that all of them are done more powerful, and you can sort of say like this item is like this in this country, if that makes sense. And then let them edit on top of that.
Yeah, you're saying there's a core set of sections.
Really, really useful to make sure that are not changed.
The survey that is done by Pratiksha, I think it's specific to hemoglobinopathies and other common disorders. So like what group of disorders does it carry? I mean, is it all the rare disorders or familial hereditary cancers? Or
well, once again, we don't want to constrain what this is about. We want you to apply it to what disorder is important for you. Yeah.
The thing is,
It's cancer,
in each country, like, we haven't done this in our country, Sri Lanka. So if I'm doing it like for the first time, can we use that generic survey that has been developed?
Yes, well, go ahead.
I think my friend's survey is trying to just assess what is like, interest regarding FHS and what is their ability to take FHS and etc. But when now moving ahead one step further, we can use FHS for targeted common disorders that is prevalent in your country, the specific country, because the disorders are, the rates are different in different countries. So, and how that can be utilized in longer run in terms of like testing and counseling as well. So those can be modified or some components can be added depending upon the disorders. It may be hemoglobinopathies, because that is quite prevalent in Nepal, and muscular dystrophy. So it may be, so we have to find out like what is the common disorders prevalent in the region.
So we can get access to that, the survey that you have used and modify it?
Yes. So that is the ongoing discussion. Yeah.
Great. So we're going to add you to this list. Now, I said we were going to go through this really fast, and we're off to a very slow start. But I think it's okay, because I've always felt like this step was a very important first step. And a lot of people are still even struggling with this first step. But I feel like if we did this, if everybody did this, then all of a sudden you'd have a clearer picture of where you're going next. So anyway, we will continue to focus on this first step. But let me start going. And now we've got like 1.5 minutes for each of the remaining steps, but that's okay. Determine the desired data elements to be collected. So what data do you actually want to collect? Now there is a standard, I have this link here, and if you want me to get you this link, but I wrote this draft document with my work with the GA4GH, and we call it a common data set for family health history. And in this document, we have a table and it has individual data elements in there. First name, last name, where you live, but then other stuff like relative, description of the relative, what disease do they have, what was the age of onset of that disease, did they die of that disease. So there's I'm just giving some small examples. There's a long list that is in this document of what we call a common data set. But you need to know, okay, these are the data elements we need to collect. And so you should write that down on something. This isn't a huge step, just to write that down. And so then you have a document that everybody can, when I say everybody, all your colleagues can see, okay, this is what we all believe in. As far as data elements we want to collect. Okay, moving on. Identify what current data sets already exist in your countries. There might be somebody already might be collecting some family histories or some pedigrees, maybe in a research setting already. And so you want to discover if there's data sets that already exist somewhere that you can work with. Not only maybe you can benefit from, but you can collaborate with the people that have that data set. So find out if there are existing data sets. Identify the current methods of collecting and assessing the family history. So what is being used today? Is it paper-based that collects family history? Do you have some computer-based app that's collecting it? Where's the paper being stored? Where's the computer data being stored? How's it being accessed? So identify what the current methods of collecting and using family health history data is, so you know what's going on. You'll probably find a lot of different methods are being used. And that's great to know, because then you, as you get together with people, say, hey, let's maybe decide on a single method, a standardized method that everybody will share. Dr. Isa Helving, who's originally from the Netherlands, but just moved to the US to work at the Mayo Clinic. She's a very active person and writes a lot of papers and that type of thing. She said that she had this idea for this quick paper, this quick study that looks at a specific family history questionnaire. So what I mean by questionnaire is a list of questions. It's not necessarily an application. It's not a computer app. It's just a list of questions that had been developed in the Netherlands. And she wanted to take that list of questions and apply it to the area of hemoglobinopathies and do a little study to see if that questionnaire is the right questions for collecting data on hemoglobinopathies. So this step talks about her idea of doing that study. And she has a draft paper of that study. So people who are interested in that part can sign up and participate in that too. Now, when you say, okay, well, what do I want? I've done all this work to identify what's going on today, what people are doing or not doing, what methods being used. What do I need for the future? So this step is to collect that in a document, not big of a deal. These are the features I don't have today that I want in the future. So we're going to collect that in a document. That gives us a document as a goal. Okay, this is what we're working towards. This is what we want to accomplish. Education and training information. So obviously, as any clinical implementation of family history is going to require some training for the people that are going to help collect this data. So you're going to have people in your office who might be collecting the data, or clinical assistants, nurses who might help the doctor with collecting this data, who need to be trained on how to do that. So the education and training part is a big part of this whole step. So we have that as a step to focus on. As we do this family history work, one of the reasons why we're doing this is because we want to use, not only can we use a family history in a clinical setting to assess genetic risk for a patient, but the next step is to take that family history and use it to help guide what genetic testing we want to do next for the patient. So that is a major value of doing family history. And so that's why we put it up here as a step. And we'll have these people look at, okay, then how do I go from having that family history to ordering the genetic test, getting the results back, and interpreting the results of that test. And the family history is part of that process. We're doing pretty good because you guys are just being nice and quiet. Wow, look at just Grant Wood on this one. This is because, this resource center is a new working group within G2MC. And in fact, the hour before we had our first resource center meeting. And I put this in here because I wanted to connect those two activities. The resource center is going to be an online place where we're going to store a lot of artifacts that we want to be shareable, so that that particular artifact might be important for someone who's doing a specific project. And in this online resource center, we're going to have a lot of family health history artifacts that we're going to put in. And I mentioned the algorithm part earlier. The resource center is going to be where we're going to store the collection of all those algorithms. And so, since we're already starting projects within family history that will end in a artifact that will go into the resource center. That's why I had that as a step here. Doesn't matter if I'm up there by myself, because it's my interest. Okay. Well, let's see. Sharing experiences and disseminating results. So this is really gets to the big purpose of G2MC is we want to share our experiences with each other. We want to share what barriers we had to overcome and how we did it, what solutions we found that worked. So this makes sense that as we go through those other steps, that hopefully we built the family health history clinical program that's running, right? It's up and running. And then the next step is to share with the world what we've done and how we did it. And like I say, what problems we had to overcome and that type of thing. So that's why that's step 10. The last one is just this funding thing. And this is another thing we struggle with. I put this at the very end because I don't want us to worry about this part. Even though money and funding is always an issue. But it is a part of what we're working on. We have to think in terms of funding. So that's on the list, but I put it at the end because I don't want it to get in the way of accomplishing other stuff with the tech. Okay, so how much time? Oh, we got 12 more minutes. Oh, I'm going, well, that's really. Let me ask the group on any of these steps that I went through. Do you have questions? We can go back to any step. Do you have questions on any step that we can go back to and look at? If we don't have questions, then I'll say that our next steps will be Theodora and Pratisha and I will discuss on our next calls which ones we'll focus on. I guess we'll just like focus on step 1 for the next call and maybe 2 and 3 after that or something like that. And just go by each one over the next 6 months. Focus on all these steps and actually get to a point where instead of just talking about it on a call, we can say, okay, we've got 4 people, 5 people are going to do a survey and say, okay, well, tell us how you're going to get started. You know, when are you going to report back? You know, that type of thing. It's really easy to, and I've been part of these groups for many years. It's really easy to kind of sit back and enjoy the conversation because you learn from the conversation, but the actual activities is a little bit more difficult because we all have day jobs, right? We all still have our day job responsibilities. But we hope that by asking for you to commit a little bit of time in this project, you'll get some benefit from it too. This isn't the homework assignment. This isn't the class, right? You're not going to be fired or anything. But we hope that you'll find benefit from doing this step. So, and that's hopefully how they're designed, that you will benefit from it. So that's the idea. I really don't have anything further to say, unless, like I say, any comments, questions, insights.
Can I ask a question?
Yes, you can.
Sorry, pharmacogenomics, people hanging out with rare disease people, I always find super interesting. And I guess one of my questions is, as usual, I guess the lack of overlap. So, for example, in terms of family history, we know that mitochondrial RNR1 is quite a useful tool for predicting acute loss of hearing from aminoglycosides, which we prescribe a lot to a lot of people, and people have been focusing then on implementing that. But I've not heard any discussion ever of people doing something really simple, which is saying before you give antibiotics, hey, has anyone in your mom's family lost their hearing after having an antibiotic? So I guess I would like to know from the group if this is something that's of interest and that people would like to have discussions about, and maybe sort of the different pros, cons, behavioral aspects, and just a general conversation that I think hasn't happened yet, and that surprises me.
Go ahead. You can answer.
Well, Giving it, I will give you my personal views, but also me working with the FHH group for so many years. Actually, pharmacogenomics are key, or can become even more key parameters in that story. Because, for example, in this case, in those steps, pharmacogenomics are there. So if you haven't seen the discipline, it's there. We tried to put forward those steps for those people that find more interested implementing family health history data as risk assessment for decision making prenatally, or for family planning. But that said, for example, my personal interest in pharmacogenomics and family health history comes via drug repurposing and controlling drug-drug interactions. There have been great efforts also through the G2MC for using family health history as a risk assessment tool for drug administration. There have been national policies in Europe for statins, for example, and how they can be used or not, or where, and in terms of cardiovascular disease. So that impact of family health history information brings together different disciplines like cancer genomics, pharmacogenomics, you name it, really. And we have seen that this information is impactful. So I tried to give you an overview also for the members that are a little bit, new to us. But yeah, if you can see something of what we have been described to be relevant to your area of studying or workplace, then yes, pharmacogenomics is key.
Yeah, actually, from my
Also, yes.
So from my experience in implementing pharmacogenomics, we are collecting this information about family history, but it's very basic, in a basic way. So I'm looking forward, how can we improve this in order to, and we are not taking it into consideration actually, because we are doing it just at research level, and we are doing it for everyone who is consenting, regardless of family history, but we are collecting it anyway. So the point is, I see that we are collecting it just because it was in the protocol for collection. Yeah. I can see we are not really giving it its true value, and we are not using the maybe in the future we have to look back at what we have collected and we will find the value of what we have collected. But thinking forward, we have to redesign the how we are collecting this information to make it more useful later on. So yeah.
Can I add very briefly on that? So now, for example, if we do that as an exercise, you identify the need, right? Mm-hmm. So you can apply that with a survey, step one.
Yeah, step one.
So it becomes, something tangible. It is not just an idea, a valuable idea, but you get information. And maybe, you find out that this is of relevance to most of your colleagues, or maybe you find out that you are the only one, it depends on the data. And then from that point and onward, we can discuss in the group. For example, we can put that information into an algorithm, and it can, be a weighted parameter for an answer, or maybe we need to let the community know about it, so it can become a paper or a statement, or have some educational aspects regarding that. So it's a stepwise process. This is what I wanted to put a note here, because otherwise we will drink coffee, we will discuss about the beauty of it, and then nothing is gonna happen, So I'm a little bit pragmatic here also, so it needs to be a stepwise process, and of course we are always here to help, because otherwise it's not easy.
I do think we can do better though with family history. For example, now in neonatal care units in the UK, we do have accessibility for mitochondrial RNR1 testing, okay? But there's no evidence that anyone in the centres where that testing isn't available, or even the centres where it is asking for maternal family history of hearing loss with antibiotics. And so we don't know how that stacks up. We have no idea. but around the world, we can all ask for a family history without genetic testing. So I think it's an interesting question, but I'm not convinced that the pharmacogenomics community utilizes routine genetic tools like family history completely.
I want to quickly address both of your questions with this. First of all, you're right. Pharmacogenomics is not an area that family health history has been applied to as much as it should or could be. And one of the reasons why is because we're still struggling to get basic family health history done, right? But we always, you talk to anybody who's in family health history, we'll say, yes, we'd love to expand it to pharmacogenomics. And I think it could be very easily done. You know, once you have the pedigree structure there that you can, and a tool that draws that and collects that and stuff, putting pharmacogenomic data, putting, you know, prescriptions or drug use data on that pedigree is just another data element that is next to, oh, they had cancer or they have, you know, diabetes or something. It's just another data element. But then, of course, then you need to come up with its own algorithm that then assesses that data. You know, what does it mean? So I think the opportunity is easy there. So please be a champion and help lead this, because and yes, so say yes, I'm going to be.
Yeah, I'm going to be.
Last Thursday, next month. Monkey calls.
Well, that's right. We do have a new pharmacogenomic group, right? In G2MC? No, that's G for GH. I'm sorry.
Yes. No.
Wrong group.
I am on that one. John, yeah.
I was, you know, sponsoring our monthly calls so that we keep in touch and, you know,
Yeah.
yes.
But there's good interface there, the digital coding of pharmacogenomic information, the standardization, good synergy.
And I was just going to ask your question quickly, just like, where do I find some help and, you know, some knowledge? As a group, we come together and we discuss things kind of like generally and try to get through a project like this. But we do want to have time on group calls to ask specific questions. So please request first that time and we'll do that. And also the idea is if you identify people within the group, like a single person or two people that you think might have the knowledge that you want, the idea is connect with those people and make an introduction and start collaborating with that people. That's the other option too. I'm happy to come to Dubai anytime you want.
Or that way,
But we're all courting invitation.